I'm a hair mineral analysis expert. I have a background in functional medicine, and I educate people using HTMA testing to maximize health, erase debilitating symptoms, and gain energy. I'm a multi-time kettlebell sport world champion, and I'm constantly searching for high-performance pros from all over the world to bring you this human optimization podcast. My name is Lisa Pitel-Killah. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. And I am so excited to announce our guest for today's show. Dr. Pawluk, a pioneer in the field of holistic medicine and PEMF, which is pulsed electromagnetic field therapy. His latest book, Supercharge Your Health with PEMFs, and we're going to talk all about that, is the most comprehensive, practical, hands-on guide to PEMF treatment available to date, discussing how to select and properly use the right PEMF therapy for you for over 80 different health conditions, and cuts through the online confusion about PEMF devices, all based on his extensive knowledge and clinical experience with PEMFs for over 25 years of medical practice. Welcome.
Thank you. I could clarify that a little bit. It's over 50 years of medical practice, about 17 years of holistic medical practice within that 50 years.
Amazing. Amazing.
And I've been working with magnetic field therapies for about 30 years.
Okay. And so let's talk. I know that everybody is very familiar with EMFs, and we are going to talk about that. I want to talk about the difference between what those mean. But what are pulsed magnetic fields and how do they work?
All right. So first thing is that everybody knows about a magnet, like fridge magnets and other kinds of magnets. Those are what we call static magnetic fields. In other words, they're not in motion. They're just there. They're static. They're not dynamic. And then along the way, engineers and other people began to discover that when current flows through a wire, you have a magnetic field around it. That's why we have questions about the electromagnetic fields from power lines. Right? Because any wire that carries current is going to have a magnetic field around it.
Of course.
So a pulse magnetic field, basically, a static field is steady and a pulse field is going like that. Right? And there are different kinds of pulse magnetic fields. There are the microwave type magnetic fields, which I know we'll get into in a second.
Yep.
So they are broadcast into the environment. So that's called an open loop magnetic field. It's completely open. Whereas a current flowing through a wire is basically pulsing. So the current rises and falls, rises and falls. It doesn't go out into space. It's very limited. It's limited to the wire, and it's limited to the intensity of the magnetic field around the coils that the current's flowing through, and also the strength of the current flowing through those coils. That determines how big this magnetic field is, but it's always going to collapse on itself. It doesn't go on, forever. So you can't really talk about wavelengths with PEMFs. Whereas you can talk about wavelengths for light and microwaves and so on.
Yeah, makes total sense. And so let's talk about, because I think more people are concerned today about EMFs. So let's talk about the difference, because EMFs are harmful, whereas PEMFs are therapies. So let's talk about the difference in what those mean.
Now, EMFs can be harnessed to be helpful.
Okay.
But they are helpful mostly from the perspective of actually doing damage in the tissue. So we use radiation, specifically focused radiation like heat or ultrasound waves or high frequency waves, to actually burn tissue. So if you have a wart or if you have a lesion pressing on a nerve somewhere, you want to burn it to get rid of the pressure on the nerve. So we're using those applications in medicine today. Those are called radio frequency treatments or radio frequency ablation treatments typically. So they are high intensity, very short wavelengths. Because they're very short wavelengths, so EMFs are very short wavelengths. And as a result, they get absorbed by the body.
Right.
So when you have a cell phone to your head, that's a microwave, right? It's microwave magnetic fields, basically, is what we're doing, is we're broadcasting that to our head. So if you hold a cell phone to your ears, you will see, if you hold it there long enough, you will see that the ear turns bright red. Right?
Yeah.
You've seen that yourself.
Mhm.
So what's happening is that the microwaves coming from the cell phone are cooking your ear,
Oh my goodness.
right? They're actually making
Mhm.
it warm. They're heating up the ear because those microwaves, because they're so tiny and so short, are absorbed by the body. PEMFs go through the body completely. The body is like air to a magnetic field. Nothing in the body stops the magnetic field. The magnetic field doesn't care about the body. It doesn't exist to the magnetic
Right.
field.
Yeah.
But the body is aware of the magnetic field, and that's
Mhm.
why we're using this for harnessing this for healing and for medical purposes. So the EMFs, I call them environmental magnetic fields. They really stand for electromagnetic fields.
Yeah.
But I renamed them for my purposes as environmental magnetic fields. In other words, they're produced for other purposes other than the radiation fields that are done to burn tissue on purpose.
Yep.
They are in general developed for other purposes, primarily communication, right? But there are other purposes. They're environmental magnetic fields, and we're constantly exposed to them, and they're broadcast out into the atmosphere. They're open loop, right?
Yeah.
So they can be harmful because they basically cause heating.
Right.
And when they cause heating, they cause genetic damage. They can actually, as I said, burn tissue if you design it for that on purpose.
Mhm.
But primarily because they're absorbed by the body has to react. And if you're, other than your ear, if you hold a cell phone to your chest, you will cause some degree of penetration of that electromagnetic field, the EMF, into the body.
Yeah.
Not very deep, but some.
Yeah.
And the stronger the magnetic field, the more focused. This is where 5G becomes a problem. The more focused it is. Now, because 5G is so focused, in other words, the fields are so tiny, the magnetic fields and the wavelengths are so tiny, you have to put 5G radiators, basically, antennas all over the place.
Wow.
Right? So they're not unlike a big mast, microwave mast on the top of a hill that broadcasts 20, 30 miles away.
Yeah.
These 5G generators don't broadcast that far because the fields are so intense, they lose the intensity very rapidly. And that's a basic principle of physics. The intensity drops off very rapidly. And unless you're sitting in front of that antenna, which is what you're doing with the phone.
Yes.
Right? Unless you're sitting right in front of the antenna, the field drops off extraordinarily rapidly. So you can get hurt by being right next to the antenna. You may accumulate the frequencies when you're farther away from the antenna, which is going to create some small amount of stress on the body, but not huge. So the distance from the source of that field becomes critical,
of course,
in terms of how it's going to affect the body.
Yeah.
Now, if your body is already lit up, it's already hot, it's hyper-excitable, particularly the nervous system, where you got a lot of inflammation in the body, then everything is excited. So even being farther away from that 5G is still going to turn things on, excite the body, which then creates all kinds of symptoms. Now, if you happen to be very healthy and you're dynamic and you're a 25-year-old and running marathons and so on, you're probably going to be relatively resistant to those fields. But when you get Lyme disease, or you have multiple chemical sensitivity, or you have fibromyalgia or chronic fatigue syndrome, well, you have a body that's basically hypersensitive because of the amount of irritation in that body already. So that even smaller amounts of exposure create a reaction, an undesirable reaction.
Yeah, exactly.
PEMFs, again, are not designed for that. PEMFs are designed for healing. They're specifically designed for that purpose. Okay, they're not designed for communication. They're designed for healing. Right. So the magnetic field then is configured in a way that's going to primarily benefit the body, whether it's low intensity magnetic fields or very high intensity magnetic fields.
And so I know there's a lot of, so let's talk about some of the different, I guess, conditions related. And not only that, but there's so many things out there when we're talking about therapies, right? PEMF therapies, there's lots of different devices. And so, you know, in your experience with regards to, I guess you can compare it to certain conditions if you feel that that's appropriate, are some of those devices more or less the more common or more used ones that are very effective? What would those devices look like?
So let's talk about them for therapy. Let's talk about regulation and approvals, formal government approvals for devices. And there are devices that are formally approved by the government for specific applications.
Okay.
As it turns out, those magnetic fields could do a lot more in the body than just that.
Yeah.
I talk about in the book, Power Tools for Health, my first book, Power Tools for Health, I talk about 25 different actions of magnetic fields. And in the Supercharge Your Health book, I also talk about those, but not with as much scientific backing. So we know we have at least 26, maybe probably even more, depending on how you look at things, actions in the body. So a magnetic field coming into the body is going to initiate all kinds of responses by the body.
Yeah.
Okay. The body controls the response, not the magnetic field. The magnetic field is just a stimulus. Now, it's not a good thing or a bad thing. It's just a stimulus. And so, yes, there are devices that are approved for healing fractures that won't heal, called non-union fractures. They've been FDA approved for, like, in the US, at least I'm sure that's true in Canada as well. They've been approved for about 25 years for healing fractures that won't heal. Wow. So if a fracture has not healed within 6 months, it's called a non-union.
Okay.
And they're a problem, because how do you get a fracture that's not healing to heal? Because the body, for some reason, has decided it's not going to heal this fracture. And there's lots of biological reasons why that could happen.
Yeah.
And there are no good solutions for it until they discovered magnetic field therapy, which is non-invasive. So you don't have to do surgery, you don't have to do splinting, you don't have to do metal, put screws and plates and so on in the body.
Yeah.
And if you put screws and plates in the body in an area where there's a non-union, there's a really good chance it's not going to work, because the non-union didn't work. So why would this work?
Right.
All it's doing is just bringing the pieces together, maybe, and then you still got a problem trying to heal those tissues. Whereas the magnetic field, what it does is it stimulates all of a sudden a healing process. So you can take a fracture that hasn't been healed for 4 or 5 years, do a magnetic field therapy on that fracture, and all of a sudden, with 6 months to a year, it's healed.
Wow, that's incredible.
Non-invasive, just by putting an electromagnetic system on that area of the fracture. So that's one application. The other application that I know has also been approved in Canada is also for using what's called TMS or RTMS, transcranial magnetic stimulation, for treating treatment-resistant depression. Yeah. So there are a number of machines that are approved now by the government to treat treatment-resistant depression, but it's also being used for OCD now. It's being studied for all kinds of neurological applications, and there's plenty of science and plenty of evidence now that says this technology can be used for a lot of different things than what the government's approved it for. So those are approved. Those we understand. So in the book, in Power Tools for Health book, I review 50 different conditions, and I provide the scientific references. So I have over 500 scientific references in that book to back up the use of PEMFs for at least 50 health conditions. Amazing. We got the 25 different actions, and those actions cross all kinds of conditions. It doesn't matter, the actions don't matter what the condition is, right? But we needed the science to show us that it works for a given condition. So that we know there are 50. And in the Supercharge for Your Health book, I review over 80 different conditions and provide specific details. So what happens then is you have to make a decision based on your condition and based on what you're trying to use the PEMFs for. You have to make a decision. What kind of magnetic field are you going to use? Yeah. Is it going to be low intensity? Is it going to be medium intensity or high intensity? Is it going to be local, or like local basically to an elbow or a fracture? Or is it going to be to a chest or a belly or a brain? Or is it going to be to the whole body?
Makes sense. Makes sense. And so with regards to, so let's talk about the safety of, because that's one of the questions that always comes up with regards to PEMFs, right? Is the safety with regards to using it for brain treatment? Tell us a little bit about that.
So we talked about EMFs having risk. Yeah. And potentially and probably fairly significantly creating harm in the body. Well, PEMFs, including those extremely high intensity magnetic fields that are applied to the brain, people get them for half an hour to an hour at a time. And in both of my books, I talk about safety. The brain is getting treatments using magnetic fields that are, let's say, approximately 7,000 or 8,000 Gauss. Okay. So Gauss is a measure of magnetic field intensity. The Earth's magnetic field is about half a Gauss. The Earth has its own natural magnetic field, and that's about half a Gauss. So Gauss is G-A-U-S-S. That's the terminology for it. So a half a Gauss versus 7,000 or 8,000 Gauss.
Wow.
right?
Big difference.
And the studies, hundreds of thousands of people have been treated with these brain treatments.
Yeah.
With virtually no side effects, with virtually no harm. Now, there's some rules, like you do with MRIs. You can't go into an MRI with metal in your body,
right?
Because of the strength of the metal. Well, PEMFs, you have to be careful in terms of the general conditions of the person. But somebody with a severe disorder may have to be a bit more careful. Somebody with significant medication may have to be a bit more careful.
Right.
But other than that, even snails and pets and humans, old and young, even young children have been treated with magnetic field therapy with those significant side effects or reactions. Now, there are contraindications.
Okay.
There are many, but there are some. One of the contraindications is implant electronics.
Okay.
So if you have a pacemaker,
right,
if your doctor told you that your pacemaker you can do an MRI with your pacemaker, then we call that pacemaker MR conditional. And a pacemaker is about and an MRI at the low end is about 15,000 Gauss. So if your pacemaker is MR conditional, you probably shouldn't be doing MRI that's greater than 15,000 Gauss.
Right.
So here we're talking about brain treatment for 8,000 Gauss, and the pacemaker and these other devices are the MRI is much higher intensity, 2 to 3 times that amount. And even the MRIs are safe if you follow the guidelines, right? You can't have something that could become a projectile.
Right.
So generally speaking, magnetic field therapy is extraordinarily safe, whether it's pets, animals, the brain, doesn't matter, even cancer. We use them for cancer treatment on a regular basis. And there's plenty of research, and I go over that in both my first book, Power Tools, and also in the Supercharge Your Health book, how to use magnetic field therapy for cancer.
I'm excited to read the Supercharge Your Health book. I just got mine, so I'm super excited to read that part and expand on that. And I am always intrigued because a lot of my personal research right now in my clinical practice is with regards to pets. And so I'm very intrigued. I've been doing infrared therapy, sauna therapy, readings and things like that for pets. So I find that really interesting that they can do this type of therapy as well. That's really incredible.
They love it. So if you're laying on your magnetic system, I hear this all the time, and I've seen it myself. If you're laying on your magnetic pad to do your own treatment, the animals come to you and they'll lay on top of you.
That's amazing. Oh my gosh.
They know when they've had enough. They leave when they've had enough.
Yeah.
So we're using it in pets, domestic pets. We're using it in horses. So a lot of work being done with equine, in the equine area. So yes, animals are and they're very sensitive to magnetic fields. So even they tolerate it.
Yeah, I can see that for sure. And so can we talk a little bit about, because I think there's a lot of evidence too, where using this type of therapy also will improve memory.
Totally. So how do magnetic fields work in terms of improving memory? There are many, many different actions and reasons why that happens. One of the reasons is that we increase ATP production in our brains. Basically, anywhere that you're doing magnetic therapy, you're increasing ATP in the area of the magnetic field between 100 and say 600%. Now, ATP is a problem because ATP is recycled very rapidly by the body. So while you're doing magnetic field therapy, you're going to have a significant increase in ATP. It's going to last for a few hours, but it's not going to last weeks or months.
Right.
We recycle our body's ATP recycles 4 to 5 times every day. And our bodies produce somewhere between about our body weight ATP a day. So why do we gain weight? Right, because it's burned up all the time. It's constantly being used up.
Yeah.
For all the metabolic processes of the body. Every cell in the body is using ATP. And we have, let's say, 100 trillion cells in our body. And every single one of those cells has 2,000 biochemical processes going on every second.
Incredible, right?
It is totally incredible.
Yeah.
So anyway, safe animals, kids, and the brain.
Yeah.
And so the memory is enhanced by ATP production, by increased circulation, by increasing nutrient uptake into the brain, by causing changes in the oscillations of the brain waves themselves.
Yeah.
So for example, gamma is a frequency, which is in our flex pulse device. that gamma frequency helps the brain to be able to process cognition. So gamma is used by the brain going from back to front to help the brain integrate information.
Okay.
And so increasing gamma in the brain decreases the risk of Alzheimer's. One of the other key factors too with brain and Alzheimer's or memory is that you are decreasing inflammation. So why do we have memory problems? Well, right? And if you think about Alzheimer's, which is the laying down of plaque in the brain, that's all being laid down to a great extent by inflammation. So how many brain processes are actually due to inflammation? So concussion, for example, is an inflammatory problem.
Yeah.
Right? That's been pretty well studied. When you drop a hammer on somebody's head, they will get a concussion, and almost immediately you develop inflammation.
Yeah.
So if you quiet down that inflammation rapidly, and the good thing about magnetic fields is they go right through the brain, they go all the way through, right? And as they go through, they're decreasing inflammation.
Well,
so there are many mechanisms of action to explain what PEMFs do.
yes, and it's so interesting, and I think a lot of people, I don't want to say misinterpret, I feel like that's the wrong word, but I feel like they miss the fact that inflammation drives so much instability and issues in the body, right? It's the underlying causal factor to so many conditions, symptoms, and issues.
Including aging.
Absolutely. You're speeding up the aging process.
Yes.
And none of us want that.
So that's one of the reasons people should be doing magnetic field therapy basically every day.
That was my next question. Yes.
Right?
How often?
Biochemical processes every second.
Yep.
Then the body's never sleeping. And as we get older, then less and less activity is going on in those cells. And the magnetic field therapy just sort of starts to wake everything up. And it keeps things awake.
Yeah.
But that means that you have to repeat it. You can't just do it once a week. You'll get a temporary benefit for once a week, but you're not going to decrease inflammation, which has to be treated at least a couple times a day.
Yeah.
So the more treatment you provide, the more benefit you provide to those cells that are fighting that inflammation.
Of course. And so what about, doing this every day, right? So what are some of the, I guess, are there potential at-home units where people can purchase, their own units so that they have that, where they don't have to go to a clinic or try, I feel like nowadays people are trying to do as many things at home as possible, obviously. And so are there any that you recommend, or what type, or what would you suggest for that respect?
So in the book, I review a bunch of different devices that I've tested personally. So I've tested hundreds of machines and used hundreds of machines. Yeah. And primarily on my website, drpawluk.com, that's drpawluk.com, we have a whole list of devices.
Oh, amazing.
And you can there's a comparison chart. We could look at the different machines. Yeah. And they, as I said, they're local versus regional versus whole body, and they're low intensity all the way up to 8,000 Gauss. Yeah. So from a medical perspective, I started my work with magnetic fields, I was 30 years ago, using static magnets. And then I discovered the limitations of static magnets for the different conditions I was trying to treat. So I said, okay, they're useful for the following, but they're not useful for all the other stuff.
Right.
So then I started working with low intensity magnetic fields, very low intensity. So I said the Earth's magnetic field is a half a Gauss, which is about 50 microtesla. So if you exceed the Earth's magnetic field, well, we're living in a 50 microtesla magnetic field anyway. So that's already treating us from that perspective. It's maintaining us at a certain level. But some things need a lot more energy. So as I mentioned, for treatment-resistant depression, you need a 7,000, 8,000 Gauss machine to adequately treat that. Yeah. And that's been found very, very safe. So then the question is, which machine is going to give you which kinds of intensities? And in some cases, frequencies are important, intensities versus the frequencies versus the area that you're treating. So if you have a stronger magnetic field and you could dial it down, then you have a device that you have a lot more room to play with.
Right.
Right. Most people buy their pieces of equipment because of a problem today.
Right. Not thinking.
Right? So they don't really consider what's going to happen 10 years from now. And as a family physician, I'm going to tell you what's going to happen 10 years from now, more or less. Right? As
You
I do
mean,
your risk assessment, I'll say, oh, here's what you could expect 10 years from now.
exactly. And I think that's a key when you mention that, just with regards to having that, the ability, right, to change and use it for more than just what you may be suffering from right now. I think that's a very, a good fact to think about. Yes.
Yeah, so where you get it because you got diabetes, or you get it
Mhm.
because you got headaches, or you get it because you got Lyme disease,
Yeah.
that's fine. It's going to help you with that.
Mhm.
But it's going to help you in ways that you don't even know,
Right.
right? In ways that you can't even count on. So basically what you're doing is you're making an investment.
Yeah.
So it's going to cost you more than you think it should, but you have to think about it as an investment in your health. It's not something you keep paying for. Now, if you go to a doctor's office or a practitioner's office for treatments, you're going to keep paying for it.
Exactly.
And in the end, you don't really own anything.
Right.
So why not own a system that you could use regularly yourself? And I tell people regularly that too, when you buy a magnetic therapy system, you don't own it. The house owns it, including the dog, the cat, the plant, and other family members if you let them.
Yeah, exactly. That's so true. I know my little Chihuahua would be all over that. He loves he's just anything to do with health, where he wants to get in the infrared sauna. He wants it, it's so interesting. Animals are so intuitive with what they need and what they want. It's so, I always find it so interesting. Every day it's something new.
How old is your Chihuahua?
He's almost 13.
13.
Yeah.
Well, your Chihuahua needs it.
I know he does, for sure.
I have a 14-year-old Westie.
Oh, amazing. Aren't they fabulous?
Westie is getting a little crotchety and slower.
Yeah. I've been lucky. My little guy's, he's doing good, but I do tons of alternative therapies with him. And, but he's still like a pup, but he gets his rest, as much needed rest. So that's always a good thing. Yeah.
Well, we don't want to, we know we have dogs who are like basically sleeping on the couch all the time, and they do magnetic therapy and all of a sudden they're up and about.
I can't wait to see the difference. And I can't wait to hear. I know so many people will be trying this and will definitely reaching out and letting us know. And so with regards, so you said every day, right? Ideally. And not that there's any, I guess, I don't want to say a general blanket suggestion, but if you were to use it every day, what kind of time investment, what are we looking at? Is this something that you're resting on? And obviously you're maybe using it for a certain period of time. What do you normally suggest with regards to a particular unit?
So again, as a holistic doctor, the question is doing the treatment according to what the body tells you. Mm-hmm. So there's no specific protocol. So ultimately, your body's going to tell you how much you need. And if you're dealing with a problem today, it's like physical therapy or acupuncture or massage, you may need a lot more treatments at the beginning, and then less and less as it goes on.
Of course, yeah.
So you may have to decide, depending on the tissue, depending on what you're treating, that you may be needing 3 or 4 hours a day at the beginning.
Yeah.
And there's no risk with that.
Yeah.
And then eventually you may need less. Now, if you're generally very healthy, let's say you run marathons regularly. Of course, if you're running marathons regularly, you're going to have lots of injuries to be treating.
I was just going to say recovery is next on my list, because there has to be such a huge part of this for recovery for athletes.
There is absolutely totally, not only for recovery, but also for performance.
Yeah.
Because if you increase circulation to tissues, if you increase ATP to tissues, and you clear out the trauma from the day before, right, then your body's always going to be at a sort of a more optimal level of functioning.
Yeah.
So yes, it's not only for healing, but also for performance.
Yeah, that makes total sense. And even just with regards to, detoxification strategy, right? If we're increasing circulation, then that's going to increase detoxification capacities in the body as well. So absolutely. I think this is a very integrative, holistic approach with regards to what you're trying to accomplish and perform, whether it's performance, whether it's, erasing symptoms, whatever the case might be.
Detox is very important, and magnetic field therapy is going to do that sort of automatically. So the thing about the magnetic therapy is all these different actions of the magnetic field.
Yeah.
We can't dial them. We don't control those actions. That's a good thing, because I'm not smart enough. Right. the body's going to control the actions.
Right.
And I prefer that, because then you listen to your body, and then you adjust what you're doing based on what your body's going to tell you.
Exactly.
So that's a good thing, and that's a safety factor. It's one of the other reasons that magnetic fields are so safe. It's that the magnetic fields aren't doing the job. All they do is provide the stimulus. The body does the job.
Right.
And then your body may need a little more today, a little less tomorrow, but it may need more multiple times a day than it does one big session a day. So your own body's going to tell you how much time you're going to need. I just generally speaking, treating in a doctor's office or a practitioner's practice, they're usually going to be using higher intensity devices. If a practitioner is using a low intensity system, you're just not going to get the results.
Right.
Because it's not strong enough. But if it's strong, you don't need as much time, and you don't need to treat as often, and the results happen faster.
Exactly.
So the stronger, the better. So I have a mantra: intensity matters. As say, for example, with inflammation, intensity matters. If you're trying to treat inflammation, then you need optimally, you need 15 Gauss at the site of inflammation. Because the inflammation that's managed by magnetic field therapy is managed by controlling the adenosine receptor in the white blood cell. So the white blood cell is our partner for inflammation.
Yeah.
It causes inflammation when you need it, but it also repairs inflammation that you don't need.
Exactly. Yeah.
Right. So it has both of those. So you need about 15 Gauss. The problem is, remember we talked before about radiation dropping off with distance?
Yep.
All magnetic fields drop off with distance. So if you have a 4,000 Gauss magnetic field, 4,000, and you need about 4,000 to treat across the brain, because the brain is going to be, generally speaking, about 6 inches on average. So if you want to treat across the brain with the magnetic field to deliver 15 Gauss at the other side of the applicator, you're going to have a 4,000 Gauss magnetic field. Yeah. To deliver 15 Gauss, 6 inches away. So you have to account for that. And I have a blog and there's an appendix in the book about that as well. I have a blog on my website that talks about adenosine and the intensities you need at the target tissue.
Oh, that'll be super helpful. Yeah. And I'll make sure, so in the description, if you're listening to this, make sure you're reading the description on your favorite podcast host, because I will have a link to Dr. Pawluk's website and his blogs, as well as links to where you can purchase his books as well. Yeah. That's amazing. And I feel like this is the next step. And so 25 years in the medical practice, now 30 years as a magnetic therapy expert and a holistic physician. Tell me, I want a little bit of background on you now, right? I want to learn a little bit more about you. So tell me, after that, all those years, what made you, realize how important this was and move in that direction?
Well, I started originally with magnetic field therapies because I had a couple of patients who almost died from gastric bleeding due to ibuprofen.
Oh my gosh.
Right. And then I said, this is crazy medicine. This is insanity.
Yeah.
So I wanted to learn something different, and I learned acupuncture. And then I learned acupuncture in 1990. So that's a long time ago. Right. That's 30 years ago right there. And people didn't want needles. They didn't understand needles. There were very few acupuncturists around at the time. So stay away from me with those needles. Yeah. So I discovered that in the Orient they were using magnets on acupuncture points. I started working with the magnets, where I worked with the static magnets first, and then eventually evolved into the other types of magnetic therapies. Let me tell you something else that's kind of really caught my attention about magnetic fields. Two things. And I said, this is real. I had a 3-year-old child, actually from British Columbia, near Vancouver. Tore off the end of her thumb. Okay. In a door jam. Gone.
That would be so, oh my gosh. Okay.
Right? 3-year-old. So we got the surgeon to basically sew the detached piece off. Yeah. Sew it back on again. You can see the suture marks, and it's in my first book, Power Tools for Health. There's the pictures that show that. So what happened is basically she used a small local therapy device that's about 200 Gauss. Okay. So not too high, not too low. And she did 3 hours, 1.5 to 3 hours a day with that on the thumb. I wanted her to do more, but a 3-year-old has a hard time doing an hour and a half.
I was going to say, to try and get them to sit down for that long, that would be tough. So
no matter what, even with that, literally 12 weeks later, she's regrowing her nail.
Wow, that's incredible.
You know, the first picture shows it's black.
Yeah.
There's no blood supply, right?
Right.
And then the tissue starts to grow. The tissue starts to grow. So all the stem cells that a child has are growing into that tissue. So she preserved the thumb, and that because the memory of the thumb was there, I guess, in a sense.
Yep.
I don't know how to explain all this. It's regenerative medicine.
Yeah.
Salamanders do the same thing, right?
Yeah.
So she regrew her thumb, 12 weeks of an hour to an hour and a half a day. So that was one of the examples of like, this.
Yeah.
They don't teach you this in medical school.
Yeah,
right?
no.
And most other schools. Then I had another guy, a patient who was brought to me by his boss, and he was purple from the knees down.
Wow.
No
Okay.
blood, virtually no blood supply. The surgeon said, we got to do amputations of both your legs below the knee. And you know, normally when you touch the skin, if you touch it with your hand, your finger, it goes blank, it goes blanches, cutting off the blood supply in the capillaries there. When you take your finger away, all of a sudden the blood fills back in again. I couldn't see any blood return.
Wow.
He was that black. He had that little circulation.
Yeah.
So he had what's called dry gangrene from diabetes and vascular disease and smoking, you know, a bunch of bad things. So I took him on as a patient. I didn't want to because I thought he was probably going to wipe out his kidneys within a day or week or so, because if he's that close that he's got to have amputations now, then my chances of helping him at that late stage are not very good.
Right.
So I got him on a diet, got him on a bunch of supplements, got him on the magnetic field therapy, had him stop smoking, which he did. He's about to lose his leg, so he was motivated.
Right.
Right. So long story short, close monitoring. So after about 3 months, he went back to the surgeon. The surgeon said, I guess we don't have to cut off your legs.
Oh my gosh. Wow.
I never got a call from the surgeon.
Wow, that is incredible. Yeah,
why
not?
How did you do this?
Yes.
Right. So if he hadn't come to see me, he would have been legless.
Wow, that's an incredible story.
Right. So there are
they both
good stories about how magnetic fields can just dramatically impact the body.
Yeah.
And the stories go on and on and on. So now why would I prescribe drugs? Right.
Yeah. Well, exactly.
Why would I let you have surgery without helping you to heal yourself after the surgery?
Yeah.
So right now, if you go and have surgery, except for all the things that you do, which are already going to be miraculous for your body compared to your twin sister who isn't doing any of that.
Right.
Right. You're going to have a more miraculous result.
Yeah.
But we're still leaving things to chance.
Right.
Right.
Yeah.
Cross our fingers. You have surgery, your wound heals. What does a surgeon do to help you heal your wound? Nothing.
Yeah.
Right. So if you did magnetic therapy after your surgery, that wound will heal in half the time. Much fewer complications, much likelihood of infections.
Yeah.
You'll heal in half. Usually it's about half the time.
Wow. Wow.
So
that is,
So imagine what we're doing if we're doing magnetic therapy on a regular basis. What are we healing that we're not even aware of?
That we don't even know is there, that we don't even realize. Yeah. And we most likely won't, because we're going to be
prevented it.
We've prevented it. It's never going to come, right?
But you never know what you've prevented.
Exactly. Wow. And so I can completely understand where that transition came from, and that because that's two very powerful stories with regards to what really is possible when you give the body what it needs and the right support, right? Yeah.
And you can't build a body, you can't build a house without bricks and mortar.
Exactly.
You can't build a body without the appropriate nutrients and supplements.
Yeah.
The body has a support. So when I put somebody on a magnetic therapy system for, say, osteoporosis, you have to give the body the nutrients that the body needs to build bone. Because if you're deficient in calcium, you're deficient in magnesium and strontium and silicon and all those other factors that go into making bone, well, you're not going to regrow bone as easily. It'll stimulate it, but it's going to take longer because you don't have the equipment you need to finish the job. You don't have the supplies. Yeah,
100%.
So magnetic therapy works along with everything else. And over the years, I've discovered when I've compared all these other technologies, including light therapies, including laser, including ultrasound, ozone, hyperbaric, they all work together, but they all cost.
Right.
So where are you going to spend your money?
Yeah.
So as a family physician, a primary care physician, holistic doctor, I've kind of seen a lot.
Yeah.
Not everything anybody can see, but I've seen a lot. And what I realized then is that you really do need magnetic field therapy to help you just in general.
Yeah.
So using any other therapies will help, but the most cost-effective therapy I've discovered
is
magnetic
that.
field.
Well, that is super interesting. And again, I think this is something where a lot of people don't realize what's capable, like what's possible. And they also don't realize the detriment that what those harmful EMFs that we talked about with the cell phone and the microwaves and all that, they really don't understand. Like everybody's excited about 5G and it's like, there's things that go along with all of that, right? And even to come down to something as simple as, don't have your cell phone on all night beside your bed, right? You need to sleep. Put it downstairs in the kitchen, put it on airplane mode, turn it off, plug it into charge. Yeah, turn off your Wi-Fi, get all that stuff off so that your body can just be without any of those.
Recover.
Yeah, exactly.
You need that time to recover from all that stimulation that you had during the day. You can't escape this stuff.
Right.
You can't escape it. So this is where magnetic field therapy then becomes important.
Even more important, I think.
Because if you're stimulating the body to be more vital and more healthy in general, and more stress resistant, whatever that stress might be.
Yeah.
If you're more stress resistant, then you recover faster, you recover better, and you don't have as much damage, and you won't age as fast from all that stress and all that other sort of nondescript damage that you're experiencing.
Yeah. Yeah. Yeah, absolutely. Wow. Well, you know what? Some amazing information shared here today. I'm so happy that you decided to join us on the show, just because, again, I think this is so important, and anybody who doesn't know about this definitely needs to, and they need to start implementing it into their daily practice if they want to be as healthy and happy and stress resilient as long as humanly possible, right? And so, yeah.
I have, if I may.
Absolutely.
I have 3 offers for your listeners and watchers. The first is if you want to just know what the 80 conditions are, I'll give you a link if you can put that in your notes.
Oh, perfect. Okay.
All you want is just a list of 80 conditions that magnetic fields can treat. Then just go to that link. The other offer is that if you want to pre-order the book or be on a waiting list for when the book comes out, because it's not out yet, it'll be out later this year.
Okay.
Before the end of the year.
Okay.
If you want to get on that pre-order list, you go to that link.
Perfect.
And if you really are excited and interested in PEMFs and have some issues that you want to have help with, then there'll be another link to set up a consultation.
Oh, fantastic.
Now, I don't do consultations. I don't have enough time to do consultations for fridge magnets. So we're talking about people with significant needs, significant health needs, who are going to be willing to spend enough money to get the right piece of equipment.
Yeah.
So we're talking about thousands of dollars, more than 1,000 at least.
Yeah.
If you're not willing to do that, then don't bother.
Yeah.
With the consultation.
Yeah.
Now,
but that's
Canada.
Well, and what an amazing offer for that, because, if somebody out there that's listening or watching is suffering, this is a great opportunity to really be able to take matters into your own hands and get some expert advice.
Because it is confusing. And even though you buy the book, you still will read through it and say, well, I still don't know what I should do for myself.
Right.
For my particular situation.
Yeah. Yeah, absolutely. Well, that is amazing. Thank you for offering. And I hope that if you're listening or watching and you are suffering from any symptoms, I really think that PEMF therapy can help you. So take advantage of that offer that was so generously contributed by Dr. Pawluk. And so thank you so much for joining us and sharing all of that information. I'm excited for that new book to come out. I think I got a sneak peek copy, I'm not going to lie, so I'll be reading it before the rest of you are, and I'm excited about that too.
You don't have to read the whole thing.
I don't have to read the whole thing? Okay.
Because there are 50 health conditions, unless you really are interested in every single health condition.
You know me, I love nerding out, so I'm going to end up reading the whole thing. I just know it.
And it's less about application.
Yeah.
It doesn't give you that really practical advice about my diabetes or my pneumonia or my COVID or, whatever. So it gives you a general idea and supports the treatment of that condition with the science. So the first book was intended primarily to provide enough basis for magnetic field therapy that people could be comfortable with it. Because if you're going to make that kind of investment, you want to know that this has a reasonable chance of working. Exactly. And it's not just a salesperson talking to you about it. Yeah. Right. It's a doctor who's got the science backing to be able to tell you, it can work.
Yeah. Yeah, absolutely. And then obviously Supercharge is more of the applications, right? Yeah. It's practical about how to choose, how to use, your condition, and then what is suggested for that. So critical information. Yeah, absolutely. And so we'll have all those links in the description. Make sure you take advantage of the offers here today. And if you're watching on YouTube, thank you so much for watching. Give our show a thumbs up. We have a brand new episode every 2 weeks. And if you're listening on your favorite podcast host, make sure you give this episode a like, and we'll see you next time. Thanks for listening to today's show. Head over to Pitel-Killah.com to gain access to some amazing free resources that will help you gain energy, erase debilitating symptoms, and be the best version of you. Remember to give this podcast a like and follow me on social media at Pitel-Killah. I'm here every 2 weeks with a brand new episode of the Human Optimization Podcast. Until next time.